So this is the challenge and the problem-solving process of this treatment. Um, so it's time to find some tools to manage the situation. And first of and foremost, I tell her not to worry. I tell her that it is common to experience flare-ups, and sometimes they seem to come out of nowhere. I tell her that it's also normal to feel concerned and to doubt the effectiveness of the training. So, what I do is that I refer back to the patient education where we talked about inflammation and flare ups. I also share that I have seen many, many patients with worsening symptoms that quickly subsided. And I also remind her that we should use pain responses constructively and therefore reduce the pain intensity until the pain decreases. We agree to monitor the situation over the next week, and if there is no improvement, we will consider supplementary treatment. I have particularly good experience with acupuncture and kinesiotaping for these acute flare-ups. And that is what I tell her I would consider if she shows up next session with the same pain. So she completes today's training at a lower level and performs fewer repetitions than usual. And I have the feeling that she's more calm and less doubtful when she leaves the session. And that is kind of my mission that day. Exercise session 9. 1 week later, she comes in and she reports that she feels much better. Phew. Over the weekend, her symptoms have almost disappeared and she no longer experiences pain at night. She has also stopped taking pain medication and it feels like, well, she's back on track. We decide to wait a bit before increasing the training level because I would like to have a sense that her symptoms are stable before doing that. In my experience, training level adjustments should often be made in small steps, and especially for patients with large symptom fluctuations or acute flare-ups. So small regular adjustments are in general better than large ones, as many of these patients experience load reactions and latent pain. And when I say small steps, adjustments in small steps, I mean adjustments that are not visible in the training program. So it's not about going from level 3 to level 2, but it's about considering the range of motion in an exercise, the amount of hand support, number of repetitions, time of rest between exercises, and etc. There are so many things that you can adjust that are not visible in the program, that are not closely related to any of the levels of difficulty in the training program, and that's important to highlight, I believe.